Please come down from up there and have a seat, please. So my name is Alan Noren. I'm the presiding officer of the Assembly. And the first order of business is to approve the minutes. The minutes were sent out to the faculty and staff last week. There was one person who made some suggestions which were taken. So the minutes have been revised very slightly, just 2 typos were corrected. I'd like to have a motion to approve the minutes of the last the Assembly meeting in November. Okay, second? Thank you. All in favor? Opposed? Motion passes. So the rest of the afternoon, first we have Dr. Rowley, and then when Dr. Rowley is finished, I'll give a very brief report as well. And so without further ado, Dr. Riley, please.
Okay, good afternoon. Thank you, Professor Noren. Thanks all. Hope everybody's doing well. Off to a good start of the summer. You see, I broke up my summer suit today. It was a little too hot to wear dark colors, I thought. But delighted to see everybody. It's been a while since we've been together. Needless to say, a lot's happened, right? To be charitable. So that's why the first thing, and first of all, I got to compliment Professor Noren. He and I have gotten to know each other really well. He has been a great leader of your group. He doesn't hesitate to send me emails with questions or concerns, particularly between January and April. We had a lot of dialogue. So I really do respect and appreciate Professor Noren for his leadership of the institution as well. So thank you, Professor. Much appreciated. All right, well, a couple things, and then I left most of the time for questions and answers. So just a few slides that I think top of mind issues that I know many of you talk about over lunch, over cocktails, over beer, pizza, in the labs, in the back of the classrooms, wherever. So I thought I'd hit a few of these. First of all is the New York State budget. As you know, we just went through the annual budget process, which kicks off officially around the January 15 each year, and then stretches all the way till April 1st. Went beyond April 1st this year, which is not unusual with certain state budgets, because it was a complicated budget as the governor and the Senate Majority Leader Cousins and the Speaker Hasty reported out to the public that a lot of issues got discussed this time. Needless to say, Downstate's issues got discussed in a way that hadn't happened in 40 years. And as you know, the SUNY board and the chancellor announced that in January that there would be a transformation of Downstate University Hospital to proposed outpatient only to end inpatient services. Now, needless to say, that set off lots of bombs around town, particularly in Brooklyn. The Brooklyn community really spoke out about this. Many of you did too. I want to compliment again the leadership of Professor Noren and the clinical and basic science chairs. Your voice was heard, and your letters were very impactful. Now, you have to understand, I was relatively constrained in terms of my ability because the SUNY board and the chancellor had decided on one course of action. And as I often tell people, everybody's got a boss, even me. And so that was what my bosses and superiors decided that was going to happen. But as you could tell, it did not come to play in terms of what the worst fears are. So the New York State budget priorities that the governor laid out were education, healthcare, infrastructure, and economic development. In terms of our specific issues, at the end of the session, after the initial shock and awe of the transformation plan was put out there, again, intense lobbying by members of the Brooklyn delegation, the community leaders, the community boards, UUP. I really got to compliment UUP. UUP stepped up in terms of making its voice heard regarding the proposed plan, the other unions as well. So it finally ended up that in the executive budget, that's the final budget that the governor signed, that $400 million was earmarked for Downstate in this way, and it has a lot of strings attached, so I want to make sure everybody understands what the strings are. The most immediate need that we kept articulating over the last 2 years is the fact that during COVID, we were pushed into an operating loss. So in somewhat to cover that sort of structural deficit that resulted ever since the COVID designation period, the state has allocated $100 million just for the hospital to support the operations of the hospital in this fiscal year. The second part of it is $300 million in capital money. And when we say capital, of course, that's a technical budget term for bricks and mortar, stuff you can sit in, touch, operate. That's called capital. Can't use it for faculty hiring, can't use it for hiring administrators. It has to be stuff, basically, that you can sit in, touch, feel, activate, utilize. So again, $300 million is a lot of capital money in one fell swoop. Generally, each legislative session, we only get like 50 million here, 20 million here, little pieces and parts, as I call it. Not just us, by the way, but other SUNY institutions only get little dribs and drabs of capital money in each state budget. So this $300 million is quite impactful. Now, it comes with heavy strings attached. We can't spend it because the governor and the legislature negotiated a community advisory board that will release some recommendations on how to use that $300 million, and I'll tell you about that board shortly, and to make final recommendations on the revitalization of University Hospital at Downstate. So technically, let's see if I can go forward here. This is in the statute. It was statutory language that the governor and the Assembly and the Senate negotiated. A 9-member community advisory board. Now, that community advisory board is not to me, not to the SUNY system, not to the SUNY Chancellor, Board of Trustees. It is to the governor. The governor is the ultimate decider here. So this community advisory board will be composed of 9 members. The 9 members are as follows. Oh, there's that little red thing here. The Commissioner of Health, 1 representative of organized labor representing employees at the State University of New York. We read that to mean UUP. Is that right? 1 member appointed by the temporary president of the Senate. Who's the temporary president of the Senate? Alicia, do you know? Okay, so she's not going to, she'll designate 1 other senator. Usually it's a senator, right, that she will designate to serve on this? Okay. And then 1 member appointed by the Speaker, Speaker Hasty. The Speaker Hasty himself will not, but that implies that some other member of the Assembly will, right, that he designates. Okay, so that's 2 elected officials so far. 3 more appointed by the governor. She gets 3 at-large appointments. Again, total governor's call as to who's on that, who those 3 are. 1 member appointed by the governor upon the joint recommendation of Brooklyn Community Boards 9 and 17. Those are the community boards proximate to the university here, right? So they will have to submit their names, and the governor will select from that list. And, of course, the chancellor of the State University of New York. So that's the composition. I'm not on it. No faculty member here. Professor Noren's not on it. The dean, Dean Brunacardi's not on it. Dr. Berger's not on it. This is the way it is in the bill language. So this is by state law, by statute. The commission is charged, this is directly from the bill language too, colleagues. So reasonable, scalable, and fiscally responsible plan for the financial health, viability, and sustainability of SUNY Downstate. So that's the charge to the committee that the governor will expect that they report back, I believe, by April 1 of 2025, right? As far as I know, as of today, we've not heard of any appointments thus far. And I think generally they wanted to get through the end of the letter by Alicia Goodrich is that the commission will have public hearings. The bill says 3 public hearings where members of the community, that means Brooklyn community, Downstate community, faculty, students, staff, will have the ability to show up at these public hearings and voice their viewpoint on how the hospital should be revitalized, how it should be, quote, transformed, what services should stay in the hospital, which services should not be in the hospital, what new services potentially should be considered by the governor in her final decision making. So this is it. This is the way it's going to work. Again, if you ask me, the MVP of this whole process is State Senator Zellner Myrie. He was pretty assertive, pretty muscular in terms of his view that the hospital should not close. So we owe Senator Myrie a great deal of kudos for his leadership. And again, this committee, this advisory committee should look at various options in terms of how to, transform the hospital. Now, the other part that didn't make it on here, it's 300. Yeah, 250%. So you can do the math, Rich, right? That's potentially. So potentially, if the governor accepts all of these recommendations, quote unquote, she could plus up that $300 million initial commitment by another $450 million. So that's where you get to the, theoretical $750 million infusion. So again, it was kind of weird the way they stated it. Like I said, 250% of something, very weird way that they stated it. But when you do the math, it comes up to about, as Rich confirmed, about $750 million. So now, again, this is taken from the bill language, right? The recommendation committee will study and consider the following factors. I won't read them to you, but generally, state of the building is one of the key things. The hospital's old, colleagues, no fault of our own. We didn't cause it to get old. There has been probably, 40, 50 years of benign neglect of the hospital. And oh, by the way, not just of our hospital, but it's the same when I talk to my counterpart at Upstate. Their hospital is old. Stony Brook is not as old, but they have some issues too. There's only 3 state-owned hospitals in the entire state. So, a lot of SUNY campuses have a lot of capital needs. They need new libraries, new stadiums, new auditoria, new athletic facilities, new student centers. So this is sort of an existential thing that the great state of New York has to figure out if we're going to compete as the largest state university system in the country by campuses, which is SUNY. The largest state university by enrollment is the University of California system. But we have the most campuses in New York. So this is something we talk about at the SUNY President's meeting, which I'll be headed to in Saratoga in about 3 weeks, that we keep every chancellor, I've worked for 5 now, every chancellor we said, hey, we need money. We need money to renovate facilities, we need classrooms, we need laboratories, we just need everything. So, my counterpart at SUNY Albany, Dr. Rodriguez, he says the same thing. Harvey Stanger at Binghamton says the same thing. It's almost like we're a chorus in terms of saying, hey, SUNY Chancellor, SUNY Board of Trustees, hey, Governor, we need money to renovate our campuses. So, again, one of the things that this committee is going to look at is the inpatient versus outpatient thing. Now, obviously, to have a medical school and a nursing school in particular, you have to have some level of inpatient services. But remember, the question that was posed to the community is, does it need to be at Downstate? Is there a way for us to get our clinical education of nurses and physicians distributed elsewhere? And that's sort of the crux of how this was rolled out, that the initial thought by the chancellor and the SUNY board was that, we could go to a distributed model of medical and clinical and nursing training. Is done around the country in certain places. This was a bridge too far for the community, as we now know. So again, these are the types of elements that will be moving forward here. Again, they're going to get input from health policy experts, county health department. It's sort of a grab basket of, sort of folks they're going to reach out to. Again, who really weighed in. The unions were very vigorous on this, community organizations, et cetera, the clergy. And here in Brooklyn, even Reverend Sharp in came down from Harlem to the big rally out here. So Reverend Sharpton and the National Action Network were very vigorously involved, as you know as well. So before we go to the fun topic of parking, any questions on this? Yes.
Thank you so much for the update. It's good to see you again.
Good to see you.
I just wanted to know, is there anyone at Downstate that will be speaking to the politicians that represent us on the board to make sure that they know what our needs are? Because it seems like since there is no one from Downstate representing, how will they know what we actually need as an institution?
Well, Alicia, you want to handle that? Yeah.
Once we get the okay to have that communication, sorry, hi everyone, we can make it our business to be sure that they know. Senator Zelma Myrie is fully aware of who has been in contact heavily with youth speaker. What we could create is, once I get permission, we could create that funnel of information so they are aware, because there are concerns, they want to know what's going on, they want to be sure that they hit every milestone. And I really need this? Oh, I was a cheerleader, I don't. So, just to repeat, we could create that communication ongoing as long as we get the okay. Just like Dr. Riley, I was held accountable and had to be careful of what we did speak about, and there was permissions that had to be given. Once we know how this advisory board is going to be set up, that communication can continue with Myrie, Cunningham, and all those that are on the same page. And now at this point, because this is in the budget, so I know a lot of people are kind of very, busy online looking. There was a bill that created this, that Senator Myrie did. He took that language and it got wrapped into the budget. So we are locked in and they cannot take this back from us. This community advisory board has to be in place. So, right, and I was going to say to tie in, thank you, Dr. Gwen, UUP is already there, so that conversation can be continued. I don't know during this process how much communication was being made between the union leads and everyone else that needed, because there were letters that went out that I never saw. So we can create a central place, repository, where everything kind of is funneled through and we make sure every person has a voice. We can make that happen. Of course, we have a great auditorium, so when we get those 3 sessions going, more than likely, and hope that we can make it happen here. So there'll be different opportunities that we can, allow that. Hopefully that helps, but we're still waiting. Everyone's calling, when is this board going to be started? And we have to kind of wait for the governor, and they just got out of session. So we're kind of in that holding place. We have our ideas of who we want on this board, but we have to wait. So there are suggestions and thoughts out there, and making sure that everyone has input and is solid people that want to see us succeed.
Yeah, just a fine point on that. Remember, there'll be no official downstate position, but all of you are free, once the public hearing process starts, to weigh in. I can't weigh in because the SUNY system and Downstate are technically represented by the chancellor. But you are not constrained in terms of your viewpoints, bringing other people to the hearings, voicing your concerns, sending your emails, just as you did before, Professor Norton. So there'll be no official position from me to this advisory committee. Now, I don't even know if they'll even call me to speak. It's undetermined, right, at this point. But you will have no constraints. Yes, Professor.
Yes. In 2020, Downstate was declared a COVID hospital by Governor Cuomo. And I think it lasted for about 9 months. Mm-hmm. I'm sure the hospital lost a fortune of money. All the other services couldn't function, etc. Now, it's important that the members of the community, and there are going to be 3 community, according to the plan, there are going to be 3 community meetings, know about this and know how this hospital, and we didn't get any compensatory money as far as I know. And it's important that the community, which was really riled up by especially by the union, to support this hospital. I was amazed at their love of Downstate. And it's important that they know it was done. So somebody isn't saying we're wasting money, $100 million in debt every year, and we know the background to this.
Yeah.
And this isn't the first time this has happened.
Yes.
When Litch was closed, I'm not saying Downstate was directly affected, but money was, it had to be kept open for a year with 5 or 6 people. And even in the 1990s, there was talk of closing, of saying, why should SUNY have a medical school in New York City? There are 5 or 6 others, costing much more at that time than Downstate is. And we're one of the leading medical schools in terms of underrepresented minority students. And it's important that the whole context be looked at, and not simply, inpatient, outpatient, but certainly very basic. And I'm sure that the status of the hospital in 2020 had an adverse effect on students, and certainly on clinical students.
Yes, thank you. Thank you for your comments, Professor. How do I phrase this? In Albany, there appears to be, and this is the physician side of me talking now, not the president, but there seems to be a not insignificant portion of amnestic disorder. That's the fanciest, nicest clinical way I could say it, that they have selective amnesia. From the moment, I got that call saying it was March evening, I was driving home, and I get the call from the governor's office saying the Governor Cuomo is going to announce tomorrow that you're COVID only. And I said, can we talk about this? Click, no. That's the way the conversation ended. Next thing you know, next morning he announces it on worldwide TV that Downstate's going to be COVID only. From that point on, I kept raising the issue. Hey, my colleagues, the faculty, took care of Brooklyn. How are we going to be made whole? They would not listen. The prior governor's people just dismissed it. So it's not that we haven't tried, and my team knows I've been borderline irritating about this until I was told to shut up and sit down. So that point, you're right. There is a level of amnesia that, again, each of you as a faculty member have the full right to keep raising in the appropriate forums, including this one. If you think politically, colleagues, and sometimes my job is not just to think medically in healthcare, but to think politically, the greatest leverage point we have at this health sciences university is the College of Medicine, the medical school. Now, just enter this thought experiment. Suppose a governor, not Governor Hochul, but just say a governor of New York, a generic governor of New York, announces that they're closing the only state-operated medical school in New York City. Right? That would be front page of the New York Times, the Washington Post, all over the country. The last medical school to close in the United States of America, as far as I remember, is Oral Roberts School of Medicine in Tulsa, Oklahoma in 1980-something. That's the last medical school that closed in the United States of America. We don't want to be talked about in that ilk. And so again, that's where I think the leverage point is in terms of all of your feelings about the institution can really be effective. New York cannot countenance having on the front page that they closed SUNY Downstate College of Medicine. Yes, over here. Yes.
Back here. Hey.
Hi.
So in addition to contacting this advisory board, obviously, what do you think is for the faculty governance and the faculty and the chairs sort of most likely the best channel to influence this process?
Well, again, working with Professor Noor and all the various faculty governance groups at all 5 colleges and schools at the university is going to be very important. If I were to give you as my colleagues strategic advice, is that you guys start meeting and talking about this. I'm sorry. And also engaging with UUP, which again UUP was tremendous in this whole effort. So I would say, hey, just over the summer when things are kind of quiet, start talking about this, saying, hey, how can we make our voice heard as the professors, the teachers, the caregivers at SUNY Downstate and University Hospital at Downstate, in order that once we get activated with this public hearing process, that you guys, you, my colleagues, have a vigorous presence at these 3 community meetings. You're emailing, you're sending letters, you're sending petitions, all the tools in your toolkit that you used previously. Please dust them off, reinvigorate them. Yes.
Hi, glad to see you back and looking good.
Thank you.
One concept that I don't see on these slides that I think bears an extreme value is there are 1 million people in this geographic area. It's the largest inner city population in the United States. And the principle really should be is how can Downstate play a role in providing the care that these people we know from COVID are not getting delivered to them?
Again, that's, I think, part of your theory of the case. When this thing gets into that advisory domain, you're right. We saw it up close and personal during the darkest days of COVID. These folks were coming with a lot of unmet primary care needs that exacerbated, that set them up to be, more afflicted by COVID and its sequela, right? So again, I make these arguments behind closed doors with my SUNY superiors and elected officials. My team have heard me do this ad nauseum. But yes, please keep doing that because, look, I tell people all the time when I travel around the country, I said, look, if Brooklyn succeeded from the city of New York, 2.6, 2.7 million people, we'd be the 3rd largest city in the country behind Chicago. Think about that. That's how big Brooklyn is. And then if you look at this part of Brooklyn, and I told the SUNY chancellor, the SUNY board a couple weeks ago, the audit committee, look, my university, my colleagues are in the people business. We take care of the great salt of the earth, working class, predominantly Afro-Caribbean citizenry of central Brooklyn. Those folks they deserve the same level of care as our friends across the water in Manhattan. You know, the 5 ruling families of New York, as we call them. Weill Cornell, help me out, Columbia, NYU, Sinai. that's referred to them as the five ruling families of healthcare in New York. And that's my argument. We deserve the shiniest facilities. You know, we need the nicest operating rooms, or as nice, for these wonderful people of this community. And that's the way I articulate it. And I hope you will too when you're given the opportunity. Okay, let me keep going. Any other question on that? But I know we'll have further dialogue with Professor Norton about this. Yeah, parking. Oh my gosh. This one, guys, as I've said before, I've been a total failure. These are the parking locations that we currently operate after the state garage was closed, as you know, because of structural integrity issues. And we're losing one of them, 225 Clarkson. We were notified by the landlord, right, Heidi, that they no longer wanted to renew the lease with the foundation. The way this has worked, the state doesn't lease this. The Downstate Foundation entered into a lease with the landlord to provide parking for the university. This is going to be disruptive, colleagues. How many spaces are we losing, Heidi, roughly? 130th, so we'll round up to 150, right? So, 150, that hurts. That's going to leave a mark, guys, in terms of parking. I think we've actually, Heidi, help me out. We've done as much as we can with King County's lots, right? Yeah. Mm-hmm.
We're looking at.
Yeah, thank you.
Yeah, we're looking at whether we can get some additional spots. Right now, we have virtually no waiting list right now for parking. Because actually, even though we lost 2 locations, because we also lost the 329 Clarkson
that's right,
location
yeah.
as well, we have fewer people who've been asking for parking than we had. But what's going to happen here is the people who are parking now that are actually going to be most affected, I think, are going to be students and residents. Because when we changed our parking structure, we actually were able to, because, you know, a lot of staff and faculty are working remotely at least part of the time, so many of those people gave up parking, and we were able to accommodate students and residents in a way that we hadn't before. And so they're going to probably be the first ones hit by this reduction. But we are hopeful. We will be doing some valet parking in some of our locations to accommodate more folks, and we are hopeful we'll be able to accommodate virtually everyone, because the way we give out parking is that we assign, people give us their preferences, and we assign it by seniority in parking, how long you've been parking at Downstate. There will be some disruption, but I think the bulk of the disruption will be the people who currently park at 225 Clarkson. I think most of the other people are likely to be able to be accommodated in their first or second choice. But it does mean that everyone, and that means everyone who parks, needs to answer the survey.
Yes.
Because we have to accommodate everyone. It's not just the people who park at 225. And wherever you park, if you are a parker now, respond to the survey and get your information in. And we will have, excuse me, everyone reassigned by the end of July to new parking. So.
Yeah, and again, this is a point that Heidi and our labor relations team, Adriana, speak with all the unions, because we've been very transparent with all 4 unions that, look, we don't have options here in terms of parking. I guess the question, some of you, why haven't we taken down that garage, the old one? Well, I am as stunned as you that, what, 6 years later? Where's James?
Yeah.
6 years later, still there. Because when we made the decision to close it because of 2 engineers stamped their opinion saying this thing was in danger of imminent collapse. Imminent collapse. And remember, I could not sleep well knowing that one of you guys could go get in your car and the thing collapses on you. And then what happened down in Miami, right? You know, gosh, I said that could have been this if we had not done that. The state, because it's state-owned land, the state has to take it down, right, James? That's right. The initial cost that we were told was $9 million. Now that has ballooned to what, to take it down?
This was 8, now it's blowing up to 10.
Yeah. So just to knock it down. Because my theory was, hey, knock it down and then we can have a surface lot there. They wouldn't approve that, right, Heidi?
Well, building the surface lot would have required investing a few $1 million more to fill it in and create a surface lot.
Right.
And we do have a plan for a new university center project
Correct.
to go on that location. The demolition of the garage is scheduled. James, do you know when it's scheduled to start? Because it is a project now. It took a while for the state to...
It's being incorporated in the new university center.
Well, no, it took a while for them to schedule the demolition project, but
that
it
would
is
happen.
scheduled.
Yeah, that
part
would
is
happen first.
scheduled,
Yeah, and like I said, that's been a moving target because it was pre-COVID, right? It was 2018 the first date that we were told. Then it got pushed to 2019. Then COVID happened and everything stopped in terms of construction. So you can see how it's been a moving target.
And then they didn't want to schedule it until we had money for the university
That's
center.
right.
So they held off on scheduling the demolition until we had a plan for what to do with it.
Correct. So it's not, and I'm going through all this ad nauseum and tedious so that you could see it's not because Heidi and James and I and Rich have not been trying to figure this out. But we're just constrained by, the great state of New York and its processes here. But please do complete the survey. That'll help us figure this out even more in terms of parking going forward. The next thing, parking question, yes.
Part of the strategic planning, I believe, should take into account patients.
Yes.
We need to have it so that patients who come here,
Yes.
since we want to build volume, it's easy, not that we create another barrier that they have to look around for where to go.
That's right. And again, you can make that part, of that 750 million, a measly 10 million might fix this parking issue for patients and the community. So,
I mean,
yeah.
for the next 365 days, because we need to be able to show the committee that we're not losing
Right.
volume.
We need patience, yes.
Otherwise,
Yeah.
it's easy to close.
That's right.
Right? So
Right.
we're shooting ourselves in the foot, as they
Right.
say.
Well, I've met with the chairs, and the dean knows this, and I'll get on my soapbox and rant a little bit. One of the problems we have in our clinical departments, and I'll be quite blunt with you colleagues about this, we have our own downstate faculty referring our patients outside of downstate for specialty care. That doesn't happen in the real world, guys. When I was a young physician in Houston, Texas at Baylor, I never forget this as long as I live. I happened to send a patient to MD Anderson, and I got called into the chair's office. Riley, why did you send a patient outside of Baylor College of Medicine to MD Anderson? I was slapped on the wrist for that and told that was a no-no, that you're not supposed to refer Baylor College of patients, Chuck knows this, outside of Baylor. Well, look, we need to have that same kind of mindset here. Do not send your patient who needs a complex procedure, unless we don't have it, that's different, over to, as I joke, your cousin Vinny. We have to drive up patient volume, particularly for the specialty services. So again, I've had this conversation with the chairs, have I not, Chuck? That during this period where we're under intense scrutiny, we have to grow volumes. We got to grow volumes in terms of our patients. So you're right, the amenity part, now the amenity part is the parking. So we're going to, again, valet parking is an option. We're looking at shuttles. We're trying to figure out any other way we can help patients access us, apart from parking. So again, it all gets tied in together. Sorry about that mini rant I just went on. But it's a factor. Okay, anything else on parking? Please complete the survey. Next thing, middle states. This is time for our middle states review of the entire university. This happens, I think, every 8 years. It used to be 10 years, right? Yeah, they've tightened the interval. So remember, middle states is the regional accreditor for the Northeast. The Department of Education delegates to certain regional accrediting bodies the purview to accredit institutions within a certain geographic area. When I was in Texas, it was SACS, the Southern Association of Colleges and Schools. If you're in Chicago, your colleagues at Northwestern and University of Illinois, it's the Higher Learning Commission, they call it, in Chicago. So there's these 5 or 6 regional creditors. Middle States is ours. So this is for the entire university. This is not the hospital. This is the university, meaning all the academic units have to undergo this very rigorous process that we kicked off in 2022, as you see in the far left. We went into a period of self-study. Many of you served on these self-study committees. That took several months. The evidence collection working groups, thank you again for all of you who've served on working groups and have really leaned into this. Very important. We will finalize the self-study report and submit, by December. And then our site visit has already been scheduled. It's April of 2025. We have the date set. So again, that's where an external review team will come and meet with all of us, look at our standards, look at our procedures, look at our governance processes. It's a fairly, rigorous review to make sure we can pass muster as a fully accredited university. Milestones, since it was kicked off, as you see, again, a lot of work. Dr. Imperato and his team in academic affairs has done a great job. Dr. Putman, many of you have been touched. Rich, obviously, in terms of the financial part of the self-study. This is some excellent work. I want to compliment all of you and your colleagues who have been engaged in the middle stage process. It is, I jokingly say, it's like having a root canal and a colonoscopy at the same time. It's very invasive. These are the study groups, the committees and working groups. Again, I won't read this to you, but you can see it covers all the issues germane to our operations as a university. Student affairs, planning, budgeting, governance, educational effectiveness, standards, et cetera. So this is very important that we chin this bar that we have to do every 8 years as a university. All right, pleasant news. The cafeteria project, this is coming along swimmingly. Phase 1 will be completed this September. That's a great milestone because what that means is that we will begin to use the seating part, that new extension. We'll be able to put tables and chairs there. There may be a hitch with the tables, I was advised earlier, because of procurement issues, but nonetheless, we will be able to use it, which is good news. You can see how nicely it looks. I'll show you some pretty pictures soon. So we'll have the new expanded seating area, the restrooms. We've been on a tear for 6 years to upgrade every restroom that we can, because that came through loud and clear in the community engagement survey when I first got here. Dr. Riley, the bathrooms are terrible. Second worst to the parking issue, everybody told me. So we really leaned into fixing the bathrooms, right, James? So more restrooms and new mechanical room. Phase 2 will be in February after the holidays. We will have the expanded and relocated boardroom and conference rooms, and a new mini mart will open. So again, the first phase of some food and beverage, right? And amenities. And then phase 3, of course, will be the full completion will be in November 2025 when we have the servery done, the kitchen all done, et cetera. So let me go to pretty pictures. This is the way it started. You can see the steel, and I've been walking it with Mr. Minto periodically. I think it's going to be fabulous for the community. You can see we get a lot of square footage by coming outward from the current cafeteria, wrapping the building. Is it airtight now, James? It's airtight?
It's enclosed. We walked it. Yep.
Yeah, it's airtight, which is a key phase. It's being heated and cooled. Nice glass. Just a wonderful addition to the campus. Again, that I want to compliment Mr. Minto and his team for doing a terrific job. I love rumors around here. So I heard this rumor, why'd Riley spend all this money in a cafeteria when the hospital's, losing all this money? Well, again, there tends to be, even on our campus, a little bit of selective amnesia. In the employee engagement survey that I commissioned when I got here, parking was a problem, bathrooms were a problem, and food service. Everybody complained about the cafeteria. Everybody. Whether you're a full professor, junior professor, everybody complained about the cafeteria. So again, I go to the SUNY system and say, hey, look, I need help with the cafeteria. They said, Riley, you're right. It's terrible. We're going to put up $9 million. That SUNY system put $9 million on the table. Then it was split another 2 ways between the university and the hospital. So that's the way we finance this. We got skin in the game, but SUNY system put $9 million into this project, as I recall. So no, and this was pre-COVID. This was pre-COVID. This was pre the crisis at the hospital. So when I hear that, I have to correct people's understanding about this. Why the cafeteria was done. It was a big downer for potential students. They walk through our cafeteria and say, gosh, I got to eat here every day? That's terrible. No study space. You can't eat and have a study group, and et cetera, et cetera. So look, this is going to be great for the community. You guys need space to sit down and have a cup of coffee, talk about your research, talk about your course planning. So this is going to be a great addition to the university, ladies and gentlemen. And no, it was not done knowing that we'd be in this morass over the hospital. I could not have anticipated that when I arrived here, 8 years ago, by the way. So again, this is going to be great. It's painful. It takes too long. I tell James all the time, why is this thing taking so long? If this were the private sector, it'd have been open by now. But we have to go through the state processes, which are tedious. Any questions about the cafeteria? The other question I get about this is, are we going to look at Aramark in terms of the vendor who operates? And the answer is yes, as I understand. We're going to relook at that contract. I think it ends when, Rich?
We're extending it, but we got the RFP in process, and we should have
Right, so we're doing a dance-off in terms of a new vendor for the food service. Now, the problem is there's a whole bunch of consolidation in institutional food service. There's only like 4 or 5 firms who do this anymore. It's Aramark, it's Marriott, Sodexo, who else? Compass. Who else? There's only like 4 or 5 of these. So it's a dance-off between 5 firms, whereas 20 years ago, there were probably 30 firms that do this. But there's been so much industry consolidation. But yes, we are hoping to get, you know, a new RFP, a new food vendor as well. All right, I'll stop there. Questions about anything? Yes?
Are there any plans to extend that emergency department? Sometimes it gets overcrowded.
Well, yes, look, Dr. Berger and I have lots of plans, but we can't do anything until this advisory committee makes its recommendations. So again, when we get to the public hearing part, you as one of our outstanding emergency medicine physicians should be not bashful about saying, look, we need a new emergency room. We serve, you know, this emergency room when it was built with the expectation that we do X. We're doing X plus Y in terms of patient volume. So again, this is where all of you can weigh in. If I could wave my wand, I would have fixed the ER years ago. Because as soon as I walked in, I saw it's too small, it's too cramped, the bays are too, it's not good for infection control. I mean, I know all the issues as a physician with that ER. But again, I think appropriate use of that $300 million is to do something with that ER.
Okay. Yeah, because especially not just the ER itself, but be able to get patients upstairs
Yes.
and have enough beds for them.
Correct.
Because one of the things that really bothered me about what came down from SUNY, from the chancellor's office that time, where they said, well, you know, you're only working at half capacity, that Downstate has all these beds and you're not filling them. And that wasn't true. Those beds were not open as far as having enough staff to open them. And so we were boarding, periodically we do board patients in the ER too long. And, you know, and I seen 70, 80, 90, 100-year-olds who were sick, who are waiting down there for beds and are waiting in these very crowded situations. So I think both have to be fixed.
Yes, absolutely. Again, this is the theory of the case that you as my colleagues have to be able to articulate to this advisory committee and ultimately to the governor. You know, the medical case is clear. This should have been fixed a long time ago. So now it's in the realm of politics and state government and allocation of state resources. This is the playing field we're on now in terms of the hospital. But I agree with you 100%. Yes?
One of the things that will come up in those meetings is there really a $100 million loss that, you know, because when you look at when the news came out that we were losing $100 million, and I understand it's down to 30-something or 20-something. Mm-hmm. So
yes.
I think, and what you're saying is that the rest of that 100 is really just trying to help us out with the COVID loss.
Right.
Which is not even the full COVID loss.
Right. So in other words, your point is the structural deficit, if COVID had never happened to humanity, right, what would the deficit of the hospital be? It would be only about $25 million if COVID had never happened. So that's the other part of the argument in terms of why, you know, we shouldn't be considered to be on death's door. If COVID had never happened, our structural deficit today, right, Rich, be about $25, $30 million, which is not a whole lot of money, by the way. Don't tell it beyond this room that. Yeah. Oh, yeah, kidney transplant. Dr. Rashan has advised the dean and the chair, Dr. Kujias, that she is leaving Downstate to accept a new professional opportunity, as we understand, somewhere in the tri-state region. Dr. Rashan has done a fabulous job of reactivating our kidney transplants. We're well over, how many transplants have we done? Like over 100 a year, roughly now. That is fantastic because I had to make the tough decision to shut it down because of quality issues But I told the dean, we got to get this transplant program back up and running, and she's done a terrific job. So she will be missed, but the good news is she has a very able deputy, Dr. Suresh, who is more than capable to assume the directorship of the transplant program. We have recruited a second transplant surgeon from Boston who will join Dr. Suresh, so we do not anticipate any hiccups in terms of the kidney transplant program. So that's the good news, that Dr. Roshan built a great team when she came, of coordinators, nurses, et cetera. And I've asked the dean to make sure, working with Dr. Kujias, that we give all the support we need to Dr. Suresh and his new colleague to keep the great momentum and the great service. That's another thing I brag about to elected officials, is that we have the only kidney transplant program in Brooklyn. And we have prevented more than 100 people a year from either getting off dialysis or going on dialysis. So that's a great thing for patient care. Yes, Chris. Good to see you, sir.
How do you sort of build on that? How do you broadcast that? My concern, and I think many others, is, when the announcement came out that would really disrupt a perception about Downstate and what it could offer people that are already, very loyal patients, but also for building a business. So maybe you can comment on that.
Yeah, I do have concern because, remember, part of the damage that being a COVID-only hospital afflicted us is that there was a delayed news loop in the community once we were no longer COVID-only. I was at the dry cleaners one day, and I was talking to a young lady, and she said, "You look familiar." I said, "Yeah, I don't say I'm the president right away. I said, I work at Downstate." And she said, "What do you do?" I said, "Well, I'm the president." She said, "Does the hospital still doing only COVID? Because I won't send my family there because if you guys are only doing COVID." So no. I almost dropped my dry cleaning. I said, "Look, let me walk you through this here. We are back up and running. We're delivering babies. We're doing surgery. We're taking care of patients. So please tell your family, come back." But it was a delayed news loop of about 6 to 9 months after that. So I'm worried about this, and that's why I've asked our marketing team to come up with a mini marketing campaign so that we can let the community know we're open for business. Please come. We just opened a brand new family medicine clinic on Empire. The other one was very lousy. So we're continuing to do things to try to drive more patient volume through the hospital and in our departments. So, but yes, the key thing is when you're out in the community and you hear that, like I heard in the dry cleaners, you say, "Oh, no, we're back up and running. Please come. We have great doctors. We may not have the shiniest hospital, but we got great doctors," right? And that's the way I always articulate it. So let me stop there. I'm going to get the hook. Thank you.
Thanks to everyone who is attending in person and all the people who are watching live stream. So I have just a couple slides, and I'm going to try and get you out of here at 5 o'clock, just like we promised. The executive committee has been very busy, obviously, interacting with the College of Medicine chairs and with UUP in order to get us to this point where the hospital's still standing. The executive committee had a meeting, I think about a month and a half ago, with the chancellor, and it was a short meeting, about a half an hour or so, and he explained why he wanted to close the hospital. And basically what he said is, the hospital is falling apart, it wasn't serving enough patients, and there was only $400 million on the table which wasn't enough money to fix the hospital, so that's why he was advocating closing the hospital. However, the 250% that Dr. Riley mentioned to you was then thrown into the mix, and now you have 750 million, and the chancellor thought that that might be enough money to renovate the hospital. So that's where we're at right now. The advisory board has not been fully constituted. It will be soon, but as mentioned, we have a representative, the president of the UUP, Fred Quall, is on the advisory committee, and the executive committee will be working through him to the advisory board. I don't want to go on. I have a couple of slides here, which I'm actually going to send out to you. It's sort of a little bit of a written report of what the executive committee has been up to. Are there any comments, questions? If not, I would call for someone to make a motion to adjourn the meeting. Questions? Motion to adjourn, second? Okay, thank you. Yeah, so it's a very unusual year because normally, instead of me standing here, the chair of the nominations committee, Catherine Perkins, would be presenting a slate of candidates. This year, however, there are no vacancies, and that's why, obviously, we're not presenting the slate, okay? There'll be a lot of vacancies next year at this time. Okay, so there was a motion on the table, a motion to second. Another question? I'm sorry, go ahead.
Since this is the annual faculty, what about the faculty elections themselves, since the bylaws allegedly have us be participatory in that regard?
There are no vacancies on the executive committee. So there's only what?
Terms are 2 or 3 years, so it's not hitting this year.
That's correct. So there's actually only 3 officers on the executive committee that are elected to be on the executive committee. The other members of the executive committee are the presiding officer and presiding officer-elect of the different schools and colleges. So if you do the math, that's 2 times 5. So that's the other people who are representing. So let's see, I can move this forward. Here we go. In addition to that, we have 4 senators, and none of them are up for election, but the 4 senators are senators in the SUNY faculty senate. So this is the statewide campuses. And so these are our senators, and we have 4 alternates. And these are the presiding officers of the various colleges and schools. And these are voting members of the executive committee as well. And in addition to that, because the College of Medicine has so many faculty members, they get an additional 3 members at large. So Clinton Brown, Chella, and Nick Pennington. In addition, Nick is the parliamentarian. That's an appointment that the presiding officer makes every year. We also have the chair of the SUNY University Faculty Senate Communications Committee, Alithia, and this is not a downstate position. This is a SUNY-wide position. So thanks for, we get some interesting information from Alithia. Okay, any other questions, comments? The meeting is adjourned. Thank you.
Thank you.